Hi there, welcome to today's episode of the Physiotherapy Podcast. My name is Orinda Mola Hadiwole. I'm a physiotherapy student, and today I'll be sharing with you my experience so far in my clinical postings. So the way it works is that every 2 weeks we have postings to different units. So like we spend 2 weeks each unit. So the first unit I started with is the medicine and neurology unit, commonly known as a neuromedicine unit. So what we do majorly in the unit is we treat neurological conditions, that is conditions that affect the nervous system, which includes your brain, your spinal cord, your nerves, both the spinal nerves and the cranial nerves. So medicine unit, we treat conditions like stroke, like Parkinson's, like cerebral palsy, like Guillain-Barré syndrome. We also treat all forms of paralysis and paresis. So you can see a patient who has hemiplegia, which is one-sided paralysis of their body. Usually this occurs with stroke. We have patients with hemiparesis, which is weakness. We have pseudoparesis, usually the spastic pseudoparesis. So how do we undertake assessment? How do we perform assessments for each of these conditions? We have a set of assessment modalities we perform, and these include: one, first we check for their muscle tone, we check for their muscle reflexes. This includes the elbow reflexes. We can check for the Babinski sign. We also check for balance and coordination. We check for flexibility. We check for functional impairments. Can this particular person sit by themselves? Can they walk by themselves? Can they lift their hands above their head? Also, we check for their sensation. Can they sense both the pinprick and the soft touch? Do they have good touch sensitivity? Can they feel any form of sensation, which could even include hot or cold? That's where we come in with the cold and hot test tubes. So what are the outcome measures we use to actually say, okay, this particular patient, what level are they in, and what changes or what improvement should we be expecting to see in them after our treatment modalities are administered? So some of the outcome measures include the FMI scale, which is for the functional independence. This just says, okay, how well can this person do activities of daily living by themselves? Can they feed themselves? Can they bathe by themselves? Can they dress by themselves? Can they groom themselves? It's actually under the Battle Index scale. The thing actually assesses other functional activities. Then we also have the break balance scale. This assesses their balance. How well can they stand by themselves? How well can they sit and stand? How well can they walk? What their gait like? Then we also as well do the gait analysis. So the treatment modalities usually utilized includes the therapeutic exercises to increase the muscle tone. We use the kinesiotaping usually for cases of facial paralysis, to stretch the muscles of the face and re-educate them. We also do gait re-education by using the parallel bar. We introduce persons of neurological conditions to walking. How can you walk by yourself? How can you walk with support? And just making sure the connections are being reinforced and made. Also, we use massage therapy, usually in cases of edema. Usually it occurs in pedal edema, where there is retention of fluid in their legs or their foot majorly, and then we help to use effleurage, usually massage therapy, to improve the circulation back to the heart and to the other parts of the body. Thank you so much. If you have any questions, you can as well ask, and I would be happy to answer them. Have a great day.